Oklahoma ending this year with an increase in COVID-19 cases as hospitals also deal with the flu, leaving some at or near capacity. News on 6's Emery Bryan live in Tulsa with the story for us this evening.
Well, hospital space is at a premium, especially with staffing issues at the end of the year. The combination of flu and COVID is expected to make that problem only worse. The hospitals don't look busy from the outside, but Oklahoma's medical system, top to bottom, is handling about all it can.
We're all under, a tremendous, amount of stress and burdens. And so anything that we can get the community to do to help us, the better.
A lot of the strain comes from COVID cases, with almost 4,000 new cases reported today in Oklahoma. There are 813 people hospitalized, 224 people in intensive care. And other cases are just beginning to show up through people seeking out testing and going into urgent care with less severe cases. CVS was booked up for COVID testing Friday in Tulsa, and so were some urgent care locations. The next wave of COVID could correspond with the peak of the flu.
The precautions that we have in place for COVID-19, with wearing your mask, social distancing, good hand washing, they're the same precautions that we're going to use against the flu prevention. And this is one of the reasons why our flu cases were low last year.
Health officials are urging people to get flu shots now, along with the COVID vaccine and boosters when they're eligible. Both vaccinations can be done on the same day, but once an illness develops, the next step is treatment.
The best way to know the diagnosis is to get tested.
Oklahoma's largest ambulance provider is concerned about what's coming with the cold weather, the flu, and COVID.
Anytime we see the case counts increase, we usually can correlate that with an increase in calls, responses, and transports.
And with some testing sites closed and more at-home tests being conducted, the numbers on COVID infections really won't be clear until the middle of next week. It could be early next week when the FDA recommends booster shots for children 12 to 17. Of course, they're all starting school Monday or Tuesday. Reporting live in Tulsa, Emery Bryan, Oklahoma's own News on 6.